pandemic has impacted the people's mindset as far as healthcare spending is concerned very significantly. And the key aspects are most people have postponed all discretionary spending, surgeries, so which are not important from their perspective. And also they have started saving their resources in case they get infected by COVID, so that they can spend the money on testing and also for treatment of COVID. So significantly, the discretionary spending has come down in the last 9 to 10 months. And with COVID infections coming down significantly, more number of people getting vaccinated, we expect that a significant tick will be there in discretionary spending as far as healthcare is concerned in the next 1 to 2 years. We also expect people to allocate significant additional resources in terms of preventive health checkup, wellness checkup, and also for insurance, incremental insurance coverage. So all those things might happen in the next 12 to 15 months. And in the last 8 to 9 months, the corporates have substantially slashed their budget in terms of wellness checks and also pre-employment checks. So all those aspects will probably be restored, and corporates will start spending significant portion of their money into healthcare spending for their employees, provided the COVID infection doesn't, the second wave of COVID infection doesn't happen in India, and also because of penetration of vaccination. More and more people will probably start spending, coming to the hospitals, labs, and then spending on wellness and other healthcare preventive checks. So overall, the healthcare industry expects the pent-up demands to be satisfied in the next, say, about 8 to 10 months, and also a significant increase in terms of government spending, state government spending, central government spending, corporate spending more and more on healthcare. We expect substantial increase in terms of revenue and the earnings of the healthcare industries. The union budget is concerned, we expect much more allocation, significantly larger allocation this year, keeping in mind the severe pandemic that is the country is going through. In the union budget for 2020-21, the central government allocated close to about 70,000 crores for healthcare. We hope and then we expect that the government of India will substantially increase this allocation by at least 15 to 20%, keeping in mind the severe hardships that the people have undergone, and also for improving the healthcare infrastructure. Similar allocation probably will happen from the state governments also. That is our expectation as far as our central government and state governments are concerned on the overall budget allocation. Coming to specific, we also expect significant relief in terms of GST, direct and indirect tax reliefs. Particularly, we expect, it has been a long-standing demand from the healthcare industry that GST has to be waived on all healthcare supplies and services. Basically, this is because the hospitals and labs do not have any output GST tax liability. And because there is no output tax liability, the input tax, whatever GST is suffered in the supplies, that cannot be taken credit for, and with the result, the cost of cost to the end customers is significantly higher. With the waiver of GST, probably the cost to the customer will significantly come down, and that will be a great relief for the healthcare industry. As far as direct tax is concerned, Section 80D of the income tax has to be tweaked a little to increase the insurance benefits and also the healthcare spend benefits substantially for all sections of the taxpayers, particularly the individuals. 80D is only applicable for individuals. So in case the limits are increased for insurance and healthcare spending, this will also help the insurance to penetrate into the larger sections of the society. Similarly, in Section D itself, there is a relief up to 5,000 in terms of preventive health checkups. And that 5,000 is included in the overall deduction as far as 80D is concerned as of now. The industry expects a separate deduction in terms of preventive expenditure, not only in terms of amount. This has to be increased from 5,000 to at least 15,000 rupees. And this benefit also should be included to the spouse of the taxpayers. So these overall, these additional benefits will probably spur the penetration of the insurance into larger sections of the society, and also help people to avoid unnecessary and unforeseen expenditure in terms of healthcare spending.